Hi guys, I am at my hotel on my very first day in Istanbul. So arriving in Istanbul, I was greeted by the team who drove me directly to my surgeon to have my pre-surgery checks. So my 6 surgical procedures will take place across 2 separate stages. The first is my intimate rejuvenation and the second is my dentistry. So for my intimate rejuvenation, I met with my surgeon physically after having had a video consultation in the UK. This allowed me to be physically examined to better understand what I am like post-childbirth, having had my 2 children naturally through vaginal delivery. So through childbirth, I have not had any tears or damages or stitches. Childbirth went completely to plan both times, and as a result, I had no damage or issues with my genitalia. However, after many years of having had a labiaplasty where my labia minora was reduced, it has since regrown. So resizing what it should be, I was very interested to hear that at the lowest point near the opening of the vagina, the labia minora should be 0.3 millimeters, and at the highest, longest point at the top, near the clitoris, it should be 0.5 millimeter as a suggested guideline. Now mine have regrown after having been removed several years ago, and because of this, they far exceed this measurement. It's very uncomfortable for me to sit, to ride bikes, to go to the gym and have physical workouts because this area chafes. This is not the case for every woman, but personally for me, it's something that is very uncomfortable. I had it removed years ago and it's regrown, so I'm having it removed once more. This may never happen to anybody else, or it could happen to a few. It's literally down to how your body changes with age. So having this revision surgery will allow me to be in comfort once more and enjoy working out on a daily basis. Then looking internally into my vagina, looking to establish the tightness, the elasticity of my vaginal passage after giving birth twice. The surgeon suggested that I should be 2 fingers. He said that I am this, and as such I am deemed as tight enough. This is an ideal amount. However, if he pulls at the opening of the vagina, he sees that it has lost elasticity. So what he will instead do is not tighten the canal, because that is fine as it is, but actually the opening area, to be able to bring that slightly more closed. This will give me a much better result, because the aim is not to make it uncomfortable when you have penetrative sex, but make it the maximum that it possibly can be for comfort and pleasure, especially after childbirth. Now, I'm not planning on ever having any more children. Mine are 13 and 18 years old, so they are as big as me now, and that is me as a mother done. Restoring my body back to pre-childbirth is so important. It gives me the ability to enjoy the rest of my youth and to rewind the clock. Just as I take care of the rest of my body, your genitalia is something that is so important. When you are comfortable in the skin that you are in, it makes the biggest difference. So I asked my surgeon to look at these dilators as a way to visually show me where I am at after having 2 children and where I could get to having had an intimate surgery. At the moment, he said I am 2 fingers, which is approximately here. Not necessarily in length, but we're looking at the width of this. So this is my natural resting size after having children, and he believes that I can get to here, if not here. So if we were to think of a partner as being this, I'm naturally this, and we are looking to drop down a couple of gauges, and that will increase maximum pleasure whilst also allowing comfortable use of tampons and intimacy without feeling any pain. So restoring the body back to what it was before having pregnancy. I also demonstrated to my surgeon that I have Ehlers-Danlos syndrome, hypermobility. This is something that will really begin to affect me in my 50s and 60s, but stress incontinence affects women of all ages, some from very young, with or without having had children. Now, I have sneezed and also laughed and felt moisture in my underwear, which I really feel disturbed about. We discussed this with a physical examination, and he advised that he can put a hammock to support through the groin and also internally to stop any stress incontinence. Now, if this develops later on in age, there is a more invasive surgery that goes through the stomach itself, and this would certainly take place in a couple of decades from now, not at the age of 38. So this is the step in between a more invasive surgery to give me a higher quality of life after having had children, and also having Ehlers-Danlos syndrome, which makes stress incontinence more of a risk for women. So then I had my dental examination. I had previously got wires fitted to the back of my teeth after having had adult braces. Around 11 years ago now, I didn't wear retainers. I didn't have wires on my teeth. They moved out of position. When you've had your teeth straightened, they will continue to move for the rest of your life. And naturally, if you never touch your teeth, they will always shift when we are speaking, when we are eating, if we have trauma to the mouth, if we knock our jaw. This is completely normal for teeth to move. But what we're looking to do is keep the teeth aligned and in the same alignment for the rest of your life. This means maintaining that with retainers and aligners. So once my teeth have been re-straightened, I will then continue to wear my retainers overnight as opposed to throughout the day. So part of the process of beginning this was to remove the wires from the back of my teeth, which are glued on, holding my teeth in the misaligned position after they moved from my adult braces. The dentist was able to remove this, to clean the area up, and then to scan the teeth. This gives the perfect 3D model of my teeth ready to be 3D printed for my aligner treatment. I will then also go in 2 days after having had my intimate surgery to have my 4 wisdom teeth removed, where I can then also have whitening and hygiene cleaning should I wish to my teeth. So seeing everybody involved in my treatment today, meeting all of the team, being shown to the hospital room that I will be in, the dentistry clinic, so that everything is familiar for tomorrow makes such a difference. You feel so reassured to know what to expect, where you will be going and at what time. So I will be collected from my hotel here at 9 AM in the morning tomorrow. I will fast from midnight tonight so that I have no food or liquids in my system, ready for general anaesthetic. I will also then be going in for my pre-operative checks once more, which means marking up my body for the tissue that will be removed, and as well reiterating to each of the specialists what will be taking place, how and why. I can also ask any questions that I think of from now until tomorrow, and just have a really good rest. So I'm now waiting for my room service to arrive to have a lovely dinner, my final meal, before I will then, after having my wisdom teeth removed, go on to softer food for a week or two. So it's my final meal before my surgery. I'm going to hop in the shower, I'm going to snuggle up in bed, get a really good final night's sleep before I go into the hospital in the morning. So thank you for joining me. I can't wait to show you what takes place tomorrow with my intimate surgery. And if you have any questions, thoughts, feelings, finding or feedback, please do not hesitate to leave them in the comments box below, and I will do my best to answer them. Thank you for joining me, and I will see you at surgery tomorrow.